If a child can't learn the way we teach, maybe we should teach the way they learned. Hi everyone, we are here to discuss about the making special education eligibility decision. We tackled here about the 13 categories of disabilities, RTI approach to identifying students with learning disabilities, multidisciplinary team, and the process of determining disability.
Categories of disabilities according to IDEA, which stands for Individual with Disabilities Education Act. IDEA is a federal law that supports special education and related service programming for child and youth with disability. There are 13 categories of disability. The first is autism, the second is deaf-blindness, third is deafness, fourth is hearing impairment, the fifth is mental retardation, sixth is multiple disabilities, seventh is orthopedic impairment, 8 is other health impairment, 9 is serious emotional disturbance, 10 is specific learning disabilities, 11 is speech or language impairment, 12 is traumatic brain injury, and 13 is visual impairment, including blindness. Autism means a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age of 3, that adversely affects a child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotyped movements, resistant to environmental change or change in daily routines, and unusual responses to sensory experiences. The term does not apply if a child's educational performance is adversely affected primarily because the child has serious emotional disturbance. Deaf-blindness means concomitant hearing and visual impairments, the combination which causes such severe communication and other developmental and educational problems that they cannot be accommodated in special education programs solely for children with deafness or children with blindness. We have two types of deaf-blindness. We have congenital and acquired. Congenital means a person is inborn with a sight and hearing impairment, while acquired deaf-blindness means a person experiences sight and hearing loss after in life. Deafness means a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing, with or without amplification, that adversely affect a child's educational performance. Hearing impairment means an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance but that is not included under the definition of deafness.
Mental retardation. Mental retardation is also known as intellectual disability. It means significantly sub-average general intellectual functioning existing concurrently with deficit in adaptive behavior and manifested during the developmental period that adversely affect a child's educational performance. People with intellectual disabilities can and do learn new skills, but they learn them more slowly. Multiple disabilities. Multiple disabilities means concomitant impairment such as mental retardation, blindness, mental retardation, orthopedic impairments, and etc. The combination of which causes such as severe educational problems that they cannot be accommodated in special education programs solely for one of the impairments. The term does not include blindness. So basically, persons with multiple disability have a condition of 2 or more serious disability, such as mental retardation with cerebral palsy. Another category is orthopedic impairment. It means a severe impairment that adversely affects a child's educational performance. The term includes impairment caused by congenital anomaly, impairments caused by disease, and impairments from other causes. Orthopedic impairments are impairments of the body that are severely enough to negatively impact educational ability. But this does not always mean that there is a mental disability that goes along with the impairment. So, children who have physical impairment from cerebral palsy or other diagnoses can also receive special educational services. Other health impairment. This means having limited strength, vitality, or alertness due to chronic or acute health problems such as heart condition, tuberculosis, rheumatic fever, nephritis, asthma, sickle cell anemia, hemophilia, epilepsy, lead poisoning, leukemia, or diabetes that adversely affect a child's educational performance. Unless the condition is neurological in nature, health impairment are not likely to directly affect learning. However, the secondary effect of illness and the side effect of medication can have a significant impact on memory, attention, strength, endurance, and energy.
Serious emotional disturbance. Serious emotional disturbance is defined as follows. The terms means a condition exhibiting one or more of the following characteristics over a long period of time and to make a marked degree that adversely affect the child's educational performance. Serious emotional disturbance is an ability to learn which cannot be explained by intellectual, sensory, or health factors. Special learning disability means a disorder in one or more of the basic psychological processes involved in understanding or in using language, spoken or written, that may manifest itself in an imperfect ability to listen, think, speak, read, write, spell, or to do mathematical calculation. The term includes such conditions as perceptual disability, brain injury, minimal brain dysfunction, and developmental aphasia. The term does not apply to children who have learning problems that are primarily the result of visual, hearing, or motor disabilities, of mental retardation or mental disturbance, of environmental, cultural, or economic disadvantage. Speech language impairment. Speech or language impairment means a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects child educational performance. These students have trouble in communicating during class presentation and participating. Traumatic brain injury. Traumatic brain injury means an acquired injury to the brain caused by external physical force, resulting in total or partial functional disability or psychosocial impairment, or both, that adversely affects a child's educational performance. The term applies to open or closed head injuries resulting in an impairment in one or more areas such as cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities, psychosocial behavior, physical function, information processing, and speech. These students often have memory difficulties and concentration problems due to brain injury.
Visual impairment, including blindness, means an impairment in vision that, even with correction, adversely affect a child's educational performance. The term includes both partial sight and blindness. Here are the list of the causes of visual impairment: uncorrected refractive errors, cataract, age-related macular degeneration, glaucoma, diabetic retinopathy, cornea opacity, and trachoma.
Purpose of RTI, or response to intervention. The purpose of RTI is prevention model to limit or prevent academic failure for students who are having difficulty learning by providing scientific research-based intervention to bring students up to grade level achievement. RTI model, the main variation that emerging use a 2 to 5 tiered model. In the other hand, RTI aims to identify struggling students early on and give them the support they need to thrive in school. RTI process. Each tier increasingly individualized instruction, continuous monitoring of progress to calculate gains and criteria for changing intervention, and or tiers through a team decision-making process. And RTI process begins with a high-quality instruction and universal screening of all children in the general education classroom. RTI is generally separated into three instructional tiers. Tier number 1, teachers should periodically screen their students. Teachers should periodically screen their students, and administrators as well should partake in evaluating students. We should consider their alternative approaches to measure progress, not just standard tests, and also high-quality instruction and behavioral support provided in general education classroom. Tier number 2, secondary intervention, take place for students that have not been able to advance out of Tier 1. Tier number 2 aims to supplement but not replace primary instruction. Students should be working on the same material that they are working on their general educational classes. And also, small group instruction, intensive specialized intervention provided with consistency by highly trained teachers. Tier number 3. Students need individualized learning. Goals must be specifically targeted at each student in tier number 3. And more individualized intervention or referral for
Now,
special education.
let's talk all about multidisciplinary team. Do you have any idea? So now, let's start. The multidisciplinary team is a group of health workers who are a member of different disciplines or professions, such as psychiatrists, social workers, psychologists, etc., each providing specific services to the patient. The team member independently treat various issues a patient may have, focusing on the issues in which they specialize. The different professions all have different areas of expertise, so that they can combine their skill sets if necessary to tackle complex and challenging mental health conditions. The multidisciplinary team meets regularly to discuss their works so that each patient has a work plan best suited to their individual needs. This coordinates their services and gets the team working together towards a specific set of goals. Most common multidisciplinary team members. The role and the duty of a psychiatrist is to perform assessments, provide talking therapies, prescribe medication, and investigate for physical illnesses. A psychiatrist employs treatment including talking, therapies, social intervention, and medication in the management of mental health problems. The psychiatrist work as part of a multidisciplinary team but will also be aware of a wide range of other helpful resources in the community. A psychologist provides specialized talking therapies, perform in-depth assessments of aspects of brain functioning and behavior. A psychologist have expertise in the assessment of psychological functioning, that is, personality or intellectual functioning, and in the delivery of variety of talking therapies. Talking therapies may be delivered on an individual or by group basis. Role of psychiatric nurses. Their duty is to assess difficulties, provide talking therapies, administer and monitor medication. As psychiatric nurses, undergo a degree course in the assessment and care of people with mental health problems. Occupational therapist. Occupational therapists provide skill assessments, formulate rehabilitation plan which is delivered both individually and in groups. Occupational therapists work in the rehabilitation of patients suffering with mental illness, aiming to help recovery in the occupational, social, and day-to-day skills. They also provide specialized assessments of functioning in areas such as social skills or ability to perform everyday tasks. Where the person is found to have difficulties in any of these areas, the occupational therapist will formulate a specialized program to help. Lastly, the social workers. The social workers provide support for families, provide talking therapies, advice in relation to housing, finance, and supports. Social workers place emphasis on the strength and the natural coping abilities of service users and their family in their assessment of people's need. They act to empower service users to access the services and the resources required to recover and maintain good mental health and achieve a good quality of life in terms of their relationship, income, leisure, occupation, and accommodation.
So now, let's talk about process in determining disability eligibility. Social Security Administration utilizes a five-step process in order to determine whether a claimant is eligible to receive disability benefits. So here is the five step. Step 1 is work, activity, and income. Step 2 is physical and or mental condition requirement. Step 3 is evaluate severity of medical condition in Blue Book. Step 4 is past relevant work. And step 5 is burden of proof. Step 1. Work, activity, and income. In order to receive benefits, you need to be able to prove that your disability is hindering your ability to make a living. If you are working and earn more than $1,000 a month, you are not considered disabled under the Social Security Administration guidelines. Step 2. Physical and or mental condition requirements. To pass the second step of the process, an individual's physical and or mental impairments must meet basic duration and severity requirements. An individual meets duration requirements if impairments will last a minimum of 12 months or eventually result in death. An individual meets severity requirements if the impairments interfere with their ability to perform basic work-related activities. So if, for example, you suffer from severe anxiety but not have an official diagnosis from a psychiatrist or a medical record that supports such a diagnosis, such as that you are on the medication for severe anxiety, you're likely going to be denied. Social Security Administration will move on to the third step of the process if you meet both of these requirements. Step 3. Evaluate severity of medical condition to Blue Book listing. Once it's been confirmed that your condition is serious, your condition will be compared to the medical severity listing of Social Security Administration Blue Book. The Blue Book contains established medical criteria that are so severe that if a person's impairments match them, an individual is found to be disabled. If impairments do not meet or equal one of the listing, their application will not move forward to the next step. However, even if the impairment does match a listing, it does not guarantee an application will move forward. Individual must then have their residual functional capacity or RFC assessed. An RFC assessment helps establish if an individual has the ability to work full-time or if their mental or physical impairment limit what they can and cannot do, meaning they can sustain a work schedule that consists of 8 hours workday for 5 days a week. Step 4. Fast Relevant Work or PRW. During step 4 of the process, the Social Security Administration takes a look at whether or not an individual could still meet the skill. They also look at requirements of a past job. If an individual can submit evidence showing that they can no longer perform past relevant work due to a physical and or mental impairment, Social Security Administration will go to the final step of the process. Step 5. Burden of proof for Social Security Administration. Finally, the Social Security Administration evaluates an individual's impairments. Could they perform other work currently available in the national economy? During this final step, Social Security Administration just take into account an individual's residual functional capacity or RFC, education, work experience, and age. If an individual cannot adjust to other work and meet all other rules and requirements of Step 5, they meet the disability burden of proof. Special education is of great importance for children with learning disabilities because it gives them the opportunity to get quality education in line with their unique needs. Every student with a disability is unique. They all present with various necessities accommodations, and modifications.
And that's the end of our discussion. We hope you learned a lot about making special education eligibility decision. Thank you for listening and watching.